Assalamualaikum. My name is Muhammad IZANI bin Muhammad ARIFFIN. Today, I would like to present about beta blockers. First of all, what is beta blockers? Beta blockers known as beta-adrenergic blocking agents. Beta blockers are medication that reduce your blood pressure. Beta blockers work by blocking the effects of hormone epinephrine, also known as adrenaline. Beta blocker cause your heart to beat slowly and with less force, which lowers blood pressure. Beta blockers also can help open up your veins and arteries to improve the blood flow. So for the next, I will pass to my group members.
Hi, my name is Fariesha Mazlyiana binti KUMSOL. I will present about types of beta blockers. The first one is Icebutalol. Icebutalol is used to treat hypertension, which is high blood pressure and heart rhythm disorder. It also may be used for purpose not listed in the medication guide. You should not use Icebutalol if you have a serious heart condition such as AV block, which is second and third degree, severe heart failure, or slow heartbeat that have cause of your faith. The second one is atenolol. It works by blocking the action of certain natural chemicals in your body, such as epinephrine on the heart and blood vessel. This effect lowers the heart rate, blood pressure, and strain on the heart. Atenolol may also be used to treat withdrawal symptoms and to prevent migraine headache. Next is bisoprolol. Bisoprolol is used for treating high blood pressure and heart pain, which is angina. It is prevent the neurotransmitters, which is chemical that nerves use to communicate with other nerves. It is from binding to beta receptor on nerves. The fourth one is nebivolol. Nebivolol is a cardioselective beta blockers approved for the treatment of hypertension. These produce unique nitric oxide. The last one is metoprolol. Metoprolol oral tablet is available as generic drug and as brand name drug. Metoprolol comes as immediate release and extended release tablet and an extended release capsule. It also comes in an injection tablet from that's only given by a healthcare provider. This is a drug called beta blockers. It used to treat conditions such as high blood pressure, heart failure, and angina, which is chest pain.
Beta blockers used for migraines, glaucoma, overactive thyroid, tremors, and anxiety. For glaucoma, the high blood pressure within the eyeball is reduced using beta blockers eye drops. The medication lowers the production of fluid inside the eyeball. For anxiety, beta blockers block the effect of stress hormone. Also can reduce the physical symptoms of anxiety such as trembling and sweating. For hyperactive thyroid and tremor, beta blocker reduce symptoms such as tremor and slow the heart rate of patients with an overactive thyroid.
My name is Muhammad AMMAR ATHARI bin SAZALI. Today I want to present about product for type of beta blockers. First, atenolol is tenormin, and esbuterol is cetrol. Next, bisoprolol is zebeta, and mioprolol is loperamide, and last one nebivolol is bastolic.
My name is SHAHMIER bin YAZID. I will talk about benefit of beta blockers. Beta blockers work differently than traditional anti-anxiety medication, making them a viable alternative for people who need rapid relief. This medication may be beneficial because they first are fast-acting, making them an ideal choice for people who need rapid relief. Second, work well for acute short-term anxiety. Third, can help lower blood pressure and heart rate, relieving physical symptoms. Four, may be an alternative for people who experience intolerable side effects when they take other anti-anxiety medication. Five, may be an effective option for people with anxiety disorder who also have high blood pressure or other health problem. Last, may reduce tremors, boosting the confidence of people anxious in tournament and other performance.
My name is NADHIRAH binti IBRAHIM. I will present about side effect of beta blockers. Okay, the first one is fatigue and dizziness. Beta blockers slow down your heart rate. This can trigger symptoms associated with a low blood pressure, means hypertension. Okay, the second one is a poor circulation. Your heart beats more slowly when you take a beta blockers. This are making it more difficult for the blood to reach your extremities. You might experience coolness or tingling in your hands and feet. Okay, the third one is gastrointestinal symptoms. These include upset stomach, nausea, and diarrhea or constipation. Taking beta blockers with a food may have a release stomach symptom. Okay, the fourthly is sexual dysfunction. Some people report erectile dysfunction when taking the beta blockers. This common side effect with medication that lower blood pressure. Okay, the last one is weight gain. This is a side effect of some older non-selective beta blockers. Doctors aren't sure why it happened, but it may be related to how beta blockers affect your metabolism.
The conclusion is beta blockers provide comparable benefit but no reduction in heart failure compared with other antihypertensive agents. Beta blockers, they increase the risk of stroke in elderly patients, so should not be used as first-line treatment for the prevention of heart failure. Beta blocker therapy continues to be a very important strategy in the management of a wide variety of cardiovascular patients. It remains one of a very few agents that has actually been shown to save lives. The major change from the past is that beta blockers are now lower priority for the primary treatment of hypertension. That's it for today. Thank you for listening.